Hello, and welcome to Health Matters, a show about the health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner, and I chair the Board of Commissioners Health Committee. This is American Heart Month and also Children's Dental Health Month. My guests today are Dr. Yari Lev and Dr. Bari Levine. Dr. Lev is a cardiologist and a clinical assistant professor at Thomas Jefferson University Hospital. He is the medical director of the inpatient cardiology unit at the hospital and director of quality and safety. Dr. Lev is board certified in both internal medicine and cardiology. He and his wife, Dr. Bari Levine, and their 2 young children moved last year to Marion Park. Dr. Bari Levine is a pediatric dentist who is opening a pediatric dental practice, Growing Smiles, at Montgomery Avenue and Meeting House Lane in the former Albrecht space where Doggy Style used to be located. Dr. Levine graduated from Temple University Hospital's Pediatric Dentistry Residency Program and has a master's in public health from Temple University. She is also the founder of the Growing Smiles Foundation, a dental nonprofit organization that she started with her family, dedicated to improving the oral health and overall health of underserved children in Peru. We're going to start by talking with Dr. Levine about children's dental health. Dr. Levine, how has COVID-19 affected children's dental health?
And thank you so much for having us on this show, Gilda. Bayer and I are very excited. So we have seen children who have never had cavities before start getting cavities because of COVID. Being at home all day during the lockdown and snacking all day, not really having a routine, brushing, flossing, really increased the rate of decay that we're seeing in our offices. So cavities form when bacteria in the mouth interact with sugar, and whether that's sugar from a lollipop or sugar from chips, cookies, crackers, pretzels, cereal, Cheez-Its, they all unfortunately break down to sugar in the mouth. And so when a child or even an adult for that matter is snacking all day long, the bacteria in the mouth interact with that sugar and make an acid. And that acid attack can happen from 5 minutes to 20 minutes long. And so if we're home all day, even sipping on a coffee with sugar all day long, the rate of cavities can increase. And then add on to that the mask wearing. I know for myself, when I'm wearing a mask all day long at work, I'm breathing through my mouth instead of my nose. And so having dry mouth actually reduces the saliva in our mouths. And that saliva has many protective qualities, whether it's clearing food away or helping protect against cavities. So on top of everything else, having a dry mouth also increases the risk of cavities in children and adults.
Well, we are definitely still in the midst of a COVID-19 pandemic.
Unfortunately, it's very true.
What special precautions should a pediatric dentist take to ensure safety during dental visits?
So dentists across the board have really increased their level of infection control. We have seen COVID screening questionnaires for families prior to each visit, temperature checks for children and their parents at the door, a hand sanitation station, so you're not allowed to enter the office until you either wash your hands or use a hand sanitizer. Many dental offices across the country have HEPA filters, which is high efficiency particulate air filtration to absorb both dental aerosols and contaminants. For older children, you can have them rinse with certain mouth rinses to reduce any viral viruses in their mouths. There's also extra oral suction equipment that's out there. And I always said, even before COVID, the dental office is one of the cleanest and safest places to be. And so we've even gone above and beyond our existing level of infection control. And so I really think that the dental office is one of the safest places to be for your children.
Well, generally speaking, what should a parent of a young child know about children's dental health?
So pediatric dentistry is quite different from general dentistry. Both the child's age and development really determine the kind of care they need, whether they're an infant, toddler, preteen, or adolescent. And pediatric dentists receive 2 additional years of training beyond dental school to become experts in the field. And as pediatric dentists, really everything we do is based on prevention. That's one of the reasons I love it so much. And so, and we agree with the American Academy of Pediatric Dentistry in that a child should establish a dental home. So having a place to go to the dentist and have comprehensive care from the time the first tooth comes in or no later than the first birthday.
So a child should start getting dental care when they a child's first baby tooth comes in?
So that's what the guidelines say. So from the time the first tooth comes in, but more realistic is by their first birthday. And research actually shows that the earlier a child is introduced to the dentist, and it's really like a well baby checkup at the pediatrician. We go over a lot of information that many parents just don't know. And so it's really a way to form a relationship with the parents and the child for them to set up a lifelong relationship with our office to have great oral health for a lifetime.
How often should a child be seen by a pediatric dentist?
So we recommend wellness checkups every 6 months, sometimes depending if a child, has any, certain decay that we're keeping an eye on, or if they have orthodontics and it's hard for them to keep their teeth super clean, which I just got out of braces for the second time myself, and it was hard for me to keep my own teeth clean, and I'm a dentist. So I needed cleanings every 3 months when I was in braces. And so depending on every child, it's a little bit different, but typically it's every 6 months.
And to what age should a child continue to be seen by a pediatric dentist?
So in my office, we see children from birth up through college. Every pediatric dentist has their own, whatever age they graduate their patients. Where I work now with my mom and brother, we're pediatric dentists in Yardley, the Growing Smiles there. We see children, well, they're not children anymore, but through the age of 20 is usually when we graduate them to a general dentist.
So what are the most common issues that you see arising in pediatric dentistry?
So decay is really the biggest. It's dental decay, or you'll also hear dental caries, is the most common chronic childhood disease. It's 5 times more common than asthma and 7 times more common than hay fever. So it's safe to say that we see a lot of decay, whether it's a 1-year-old, a 5-year-old, up through 20. So it's very, very common. And in addition to decay, we see gum disease, trauma, TMJ issues, and some orthodontic problems as well, when we'll refer to an orthodontist.
Is the water in Lower Merion Township fluoridated?
There's no water there's no fluoride in the water in Lower Merion Township. However, community water fluoridation has been regarded by the Centers for Disease Control and Prevention as one of the top 10 public health achievements in the 20th century. So community water fluoridation does have an impact in reducing tooth decay in the United States.
Well, the fact that we don't have it certainly must have some impact on how you treat children. How does that change the way in which you would treat children in terms of preventive care?
That's a great question. So the American Academy of Pediatric Dentistry does recommend using a toothpaste with fluoride from the time the very first tooth comes in. And we recommend having just a rice or smear amount of fluoride toothpaste on the toothbrush at that age. And then when the child graduates to a pea-size amount of fluoridated toothpaste when they're 3 and above. And now beyond that level of fluoride in the toothpaste, it's really important to have your parents speak to their pediatric dentist about their individual child's risk for cavities. They may have fluoride in the diet other ways. So it's really on an individual basis whether the child may need additional supplementation.
What type of home dental care should children have?
So we recommend that parents help brush their child's teeth both morning and night, and then flossing at night up until the age of 7 or 8. So until a child can tie their shoes on their own, that's usually a good indication that they have the hand skills to brush and floss on their own. We still have 14 and 15-year-olds that we would wish that their parents brush their teeth, and sometimes we do recommend it. So usually like 7 or 8, they can start to become more independent, and then we may recommend still helping their child brush at night, for instance, once they get a little bit older.
Some children are very anxious about seeing a dentist. How do you deal with a scared child?
So with 2 years of additional training, I really am an expert in helping most children relax at the dentist. The office environment is really helpful. So if it's bright colors, my office in Narberth is going to have a treehouse with a slide and Xboxes and gumball machines that dispense toys. So the environment's helpful. But besides that, building trust is really important. I start by telling the child that everything I do is to help them, and that what an amazing job to have, that everything you do is to help whoever is in your chair. And I tell them that every single thing that I'm going to do, it's called tell, show, do. So before I do anything, I show them exactly what I'm about to do, so there's no surprises. And I tell them that it's wonderful to be alive and to feel things, but I'm going to tell them exactly what they feel and when. And that really, for the most part, is able to relax most children.
Well, I am sure that many people are looking forward to having another local option for children's dental care. When will Growing Smiles be open? And can you tell me a little bit more about it?
Sure. My office is currently under construction. The walls are going up as we speak. So the end of February, most likely my doors will be open. And pretty much every square inch of the office was personally designed by myself to make it the most enjoyable dental experience for both parents and children. And so, as I mentioned, we're going to have a slide and amazing toys, and the space, since it was in the old Albrecht space, has 20-foot ceilings, and it's going to be painted blue like the sky. It's just going to be a relaxing, safe environment for children, and I really, really look forward to serving the local community here. And also, for every new patient, I will be making a donation to Get Cafe in Narberth to support individuals with disabilities, as I see a lot of children with special needs in my office as well.
Well, I'm sorry I have to interrupt our conversation, but we're going to have to take a break. We'll be right back to talk about heart health on Health Matters. Stay tuned.
Thanks.
Welcome back to Health Matters. I'm your host, Gilda Kramer. I'd like to welcome back Dr. Bari Levine and Dr. Yari Lev, this time to talk about heart health. Dr. Lev, how has the field of cardiology changed during the last 2 years with COVID-19?
Well, first of all, before I start, I wanted to thank you all for inviting us, and especially you, Commissioner Gilda. And generally, just to tell you a little bit about ourselves, we moved to the area just less than 6 months ago, and we live in Marion Park, and we love it. We love it especially because of the community. The community is amazing, and we made so many friends and neighbors, and it's just unbelievable. And in fact, Commissioner Gilda came to visit us with her little dog that our children loved. So it's been absolutely amazing. COVID has been tough for a lot of people, for most of the people, for all of the people, especially now with the current Omicron wave. We know of many people who are currently infected. For us specifically, it was not, an easy time. When this all started in Philadelphia in March of 2020, I personally was kind of coordinating all the COVID activities in my hospital for my division, and Bari was 9 months pregnant with our boy, Shai. And what happened is that basically we decided to play it safe because I was in the hospital all the time. She went to her parents to kind of protect herself and the baby, and I got sick from COVID, and I got really sick from COVID. I actually got sick on the day that she gave birth, and I missed the baby's birth. And I was sick at home until the baby was about a month or so, which was the first time that I met him. So it was a tough, year 2020. But it's a challenging year. For last 2 years have been very challenging for a lot of people, and especially people who think that it's going to go away already, and we're at the end of it. But then another wave starts, especially now Omicron, that so many people are sick. I'm sure that all the listeners here have people who are infected or were infected with COVID. It's just a reality, and hopefully this will improve soon. But in terms of the things that we as cardiologists have seen is we see a lot of bad things happening, a lot of cardiac events, heart attacks, different types of complications. And I think that looking backwards in the last 2 years, there are probably two main reasons that this has happened. First of all, I think especially in the first few waves, people were terrified. They didn't want to go, they didn't want to leave the house, they didn't want to go to the hospitals, they didn't want to do, anything of that. They just wanted to be home and protect themselves and their loved ones. And because of that, often they kind of delayed or deferred. Yeah, I have some chest pain, I have some shortness of breath, but that will be better. I don't want to deal with it right now. Let's wait until the COVID pandemic goes away and then we'll deal with it. And often these are some conditions that have some urgency in it. And the fact that people wait could be potentially dangerous. And we know in the last few years, there's a lot of visits of people of EMS, for example, 911 that you call, and situation of the patients are actually much worse because they waited, quote, quote, too long. So that's a big, big issue. And then the second thing that I would say that I think is also potentially harmful is some of the things that Bari has spoken about. Because in the COVID pandemic in the last 2 years, people are kind of at home most of the times, working from home. They're at home, they're more sedentary, they're less active, they less go out to the gyms or walk to work or whatever it is, bike to work. So I think all of that, and a lot of people, probably most of the people during COVID noticed this, that they're less active, they're less exercising, they're more close to the all the food and the munchies and the snacks and drinks and stuff like that. And it's just like less healthy for the teeth, but also for the heart overall. So I think that these are probably the major two factors that contribute. I will say, Gilda, I think that the most important thing, if I would have to choose one thing to focus on in terms of heart prevention, is actually COVID vaccination. And I think that it's weird, but I'll tell you, there's the reason for that is just people who, I'm healthy, I'm young relatively, and I got really sick, but that was before the vaccinations and everything. There's a lot of people who got really sick without the vaccination. There's a lot of things that we don't know about the virus yet, but we do know that people, especially who are elderly or have risk factors, high blood pressure, diabetes, et cetera, these are people who are, more prone for complications if you do have COVID. So I think that by far at this point, in addition to what I said before, go to your doctors, keep on following with your cardiologist if you have any issues, even if it's telemedicine. But I think that the factor of vaccinations and now also known booster, because booster does help in terms of reduction of your chances of getting the infection, but also if you already get it, because this variant, for example, is so contagious, but even if you do get it and you're boosted, your chance of badness is really low. And that, there's plenty of data from Europe and from Israel and from New York City that people who are vaccinated and boosted, they're much less likely to get into problems. So I would say by far the most important point is if you haven't gotten your booster yet or vaccination, please talk to your doctor and consider doing so.
So besides getting vaccinated for COVID and presumably for, other things like flu that are really important to get vaccinated for at this time of year, do you have any advice on about other things that people can do to prevent themselves from developing cardiac problems?
Well, I think that in the same line of what we were saying before, I think that it's important, especially if people have medical conditions, to continue throughout this pandemic to follow up closely with their doctors. It's very, very important. And now all hospitals, all clinics, all outpatients facilities, they have the ability to do telemedicine. And I think that telemedicine is a great option for the majority of the patients. And, you can discuss things freely for the comfort of being at home. So I think that following with your physicians, taking the medications is really, really critical not to drop during this pandemic. In addition to this, it's a very stressful time for all of us. The last 2 years have been, honestly, quite horrible. And there's people are under a lot of stress, and that leads to less exercise and eating more and gaining more weight. And also a big element is just feeling stressed, feeling stressed or depression or anxiety. These are all things that are very strongly associated with cardiac health. So I think there's some measures that we can take to try to help. And that's including, healthy nutrition and exercise as much as possible. Also, things related to mental health. If you're basically feeling stress and you think that there's any issues, talk to your doctor about it. Maybe there's things that we can do to help you. We personally, Bari and myself, practice a type of meditation that is called mindfulness meditation. And these courses are, available on Zoom. That's how we do it. Widely available at Penn, at Jefferson, which I think is an amazing center, and everywhere else. And I think that, practicing type of mindfulness meditation, which is really just focusing on your breath and, and what your sense, and just acknowledging that you have thoughts. These sound a little bit like, not really medical, but it's actually very well established that if you're dealing with depression and anxiety and stress, you have ways to manage it better that can have an impact on your health as well, specifically cardiac health.
So how important, you mentioned diet before, so, and that diet is really important to heart health. And so what really are the elements of a heart healthy diet?
You know what? I think this is from all the topics in medicine and cardiology, this is probably the most controversial one. And I'm actually very interested in different types of nutrition and diet. I have very close friends who are dealing and practicing specific diets themselves, but also preaching to it in terms of their patients. But I think it's unbelievable how much we still don't know. Like, you hear out there how many different diets there are for, maybe consider a vegan diet or this diet or a low carbs diet or ketogenic diet. And the problem is that there's not a lot of good research. It's very, very difficult to conduct good quality research in, major scale, large numbers, randomized controlled trials on diet for a million reasons I'm not going to get into. I think there's so many different diets, and some of them are almost contradicting each other. For example, I know that many of the people believe that vegan is the right way for people with cardiac disease. But on the other hand, I also am very much aware that many cardiac patients who have diabetes, the suggestion of some physicians is to reduce carbohydrates as much as possible. So, in terms of my personal view, trying to kind of filter what's the right things, I think there's consensus that you go to the supermarket, try to stay away from the center. Go to the right, all the way to the right, go all the way to the left. What does that mean? Just try to reduce as much as possible processed food. All these long lanes in the United States that you go and you see the cereals, and it's like never ending. It's all processed carbohydrates. It's not so good for you. It's better to stick to natural food and not processed food, vegetables and fruit, seasonal stuff. Go to the frozen section, buy, the frozen. Our children love the frozen blueberries and the frozen this and the frozen that, and, and milk products and meat, but real food. I think that is probably the most important aspect. And then the other aspect, which is maybe, it's a little bit difficult to do, especially with all the stress and everything, is quantities. There is clear, in the United States, obesity is a huge problem, and it is strongly associated with different cardiac conditions. So reduction of calories, not to, to be crazy with it, but amounts of food will also be, very important. So my bottom line, Gilda, I don't have a good answer for you. There's so many different diets, but I would say there's kind of a consensus amongst most of the people who practice different diets. Just try to eat unprocessed food and healthy food, real food.
I guess it's also really important to get exercise and not smoke. But what is the best type of exercise for heart health?
I think, again, there's different opinions about this. I would just say try to be as active as possible, especially people who are more, or elderly people who are less active. Just try to be as active. And it's hard because it's freezing cold outside and it's COVID. So people are afraid to go to the gym. But, whatever you can do at home, if it's weight a little bit, if it's push-ups, if you're, on a treadmill, if you can dress up and go outside for walks, any activity. I personally think that aerobic, is very good for cardiovascular. You mentioned something about smoking, and I think that smoking, there's much less smoking now than 10 or 20 years ago, but I think that should still be the focus. And the people who are listening to this talk, to this radio show, should be aware that there's excellent, in 2021, excellent medications that can really help you with the craving and smoking cessation. So ask your doctor about it.
Well, that's all we have time for on this month's show. I want to thank my guests, Dr. Yari Lev and Dr. Bari Levine, for being here and sharing their expertise on heart health and children's dental care. I'm Gilda Kramer, and I'll see you next time on Health Matters.